Please welcome the one, the only Dr. Miami.
Yeah.
There he is. Hey. Hi. How are you? Elvis Duran, good to see you.
Thank you for having me.
Have a seat, have a seat.
Sure.
So you're obviously fantastic and one of the best at what you do as far as these procedures go. But one day you decided I should be Snapchatting this and sharing it with the world. Now, wasn't that a little risky? I mean, you didn't know how people would react or respond to that, did you?
I had no idea. Actually, it was my 15-year-old daughter's idea.
Really?
Right.
Yeah.
Wow.
Yeah, she said, Dad, you should get on Snapchat. And
I mean, has she ever watched her dad do these procedures?
Oh, yeah.
And she's okay with it?
She is now. She was horrified at first. She had no, I just told her I fixed boo-boos. You know, I didn't really, she didn't really know.
Obviously, you say to these patients, hey, do you mind if I Snapchat you?
Of course, yeah. They
Do you
all
have to
sign
sign
consent.
something?
Yeah.
Okay.
Yeah,
Well,
about half the patients sign.
Well, tell Danielle, I mean, you get requests from them. Hey, when I'm under and you're moving my fat around,
Yep.
can you give a shout out to my family?
Shout out family,
Oh,
play this
seriously?
song.
That's
yeah.
nuts.
I want to hear soca music. Yeah.
First of all, what made you decide that you wanted to go into this avenue in medicine?
Well,
Right? Did you call, it is medicine. It is. It
is. Oh, yeah, for sure.
It's a surgical procedure.
It is, and it's serious, and it should not be taken lightly. Actually, my wife, who was my girlfriend then, we're married 21 years now, she got into a car accident, and she cut her lip, and an intern sewed her up, had a real bad scar, and it bothered her, and so we went to a plastic surgeon. This is back in 1990, pre-internet, and you really never got to see before and after pictures before the internet, ever. If you had before pictures, you burned them, and nobody talked about plastic surgery. And I walked into this guy's office on Park Avenue, and he had a book there, before and after pictures, and I went flipping through it, and I'm like, wow, this is magic. Where'd the tummy go? Like, how'd the nose get, like, what'd you do? How'd you do it? And it just, like, lit something inside me. And when I went to medical school, that's the first thing I went for.
Wow.
And,
So you had that incentive from your own personal experience.
oh, yeah, from my own personal experience. Yeah.
Wow, so that makes it more important.
Plus, I hated my nose, and I had my nose done, too.
You did?
Later
You got
on
it.
in
Did you
life.
do it to yourself? No.
Well, you do have a very nice nose.
Thank you, sir.
No,
Thank you.
What
Can you tell
let me
if
tell you.
anyone's had their nose done? Like, can you look around the room and go, you've had your nose done, you've had, like, can you do it?
Yeah, got it, need it, got it, need it. Got it.
Oh, my God.
Oh, boy.
That's terrible.
Danielle, you had your nose done,
I
didn't
did,
you?
yeah.
It's beautiful.
Thanks.
I tell you, you know, the feeling, and maybe you can relate to this, the feeling of being insecure about a body part and then being proud of it afterwards. It's such a great turnaround.
It's so different.
It's a
like-
game changer.
But it takes a while. Like, I remember looking in the mirror first going, hey, who is that? That's not me. 'Cause
Yes.
your nose changes your whole face.
Absolutely.
So,
I
yeah.
remember the first month or two, I'd pass mirrors and I'd do a double take it myself. Be like,
Yeah.
what?
Who's that? Well, I know, but, I mean, there's got to be something you say to people to assure them, look, you don't have to do this.
Right,
It
of
doesn't
course.
make you a better person to
No.
have a perfect nose. I mean, and
No.
I'm assuming that you have this conversation with everyone who wants to come
Everybody.
in and do a drastic change.
Yeah, yeah. And you have to do it for the right reasons. You do it for yourself. You don't do it for anybody else.
Yeah.
You're not going to get the guy or girl because you had plastic surgery. You're going to have to, you have to work on your inside first. But if it's an insecurity and it can be fixed, it does improve your self-esteem and it does let you live a happier life afterwards.
Yeah.
But if you do it for the right reasons.
Do you ever say no to
Yeah.
people? Like if someone says, I want breasts that hit the wall before I do it. Because that's your name on it. That's your brand on their face.
Why would
Absolutely,
you say
absolutely.
no to someone?
If patients come in and, for example, they're like rail skinny and they're like, I'm so fat, I need no, that's not going to work. That's called body dysmorphia disorder. So if you have something that bothers you but nobody else can see it, that's not surgery's not going to fix that, obviously. And so there's a surprising number of people that have that, and that needs therapy, not surgery.
Yeah.
And so those people
I'm so happy that you address it like this because I'm sure there are people in your position that will do anything just to take the money and run.
I'm sure.
You know?
Yeah, sadly, probably.
Yeah.
But thank God we're busy for a while, and in the end, you're not helping people by doing that. So.
And it is addictive, right? I've heard that a lot of people, once they get one thing done, they want something else and something else and something else.
Well, it's not addictive like the way cigarettes are addictive, but like it's kind of like when you fix your kitchen up and then you have like a little bathroom off the kitchen, you want to fix that up too, so it all like matches right.
Yeah.
I mean, look at the numbers here. An audience of over 800,000 viewers daily on your Snapchat. I'm sure it's grown since we wrote
It's grown,
that.
yeah, it's grown.
It's fascinating how people just love to see this. And at the end of the day, it's kind of a not gross thing, but it's it's got a
gory.
lot of,
It's gory.
Gory is the word. Why do you think there's such fascination? Why can't I just be happy looking at the end result? Why do I have to see all the guts and glory that you have to go through to get them there?
I think it's like looking behind the curtain, and the Wizard of Oz. You want to see how it's made. You want to see how the sausage is made. It's the part that you never see on Botched, that you don't really see on Grey's Anatomy, the actual cutting, the blood. And it's good because it educates people. So for some people, it turns them off. They're like, I never want to have that done to my body ever. Other people are like, it's not so bad.
Do you really truly love what you do?
Yes.
And what is it you love about right now? You obviously are having fun because there's a lot of people who do the same thing you do are not doing it like this.
Right.
I mean, you have a whole new world that you're playing with now. But what is it for you personally at the end of the day that makes you feel satisfied?
You just get a high when you're done with the surgery and you see the result. You just feel it's like a high. And then when the patient comes in, like when you went to your doctor after your nose job, I'm sure you're like smiling from ear to ear.
Of course,
and you're like, thank you. It's a great feeling.
Yeah.
Here's Greg T and his body.
Hello, Greg.
Greg T, Dr. Miami here. As you know, he's now going to, as we've seen on TV shows, he's now going to use a Sharpie marker to mark your body.
Yes.
Oh my God! Would you put that away, Greg? Damn it! You know what?
10 years, can you
Stop
do
it!
that?
Sorry, Doctor.
I apologize.
Hey.
Greg T's wiener.
First penis.
Do we have all
enlargement
day?
patient.
I mean, how much time do we have?
Oh my God! How much ink do you need for this one, Dr. Miami? All right, so Greg T's bare body is before the great doctor, and he has a Sharpie. Now describe this, and we're getting video of this to show
It's magnificent.
how Dr. Miami
He's an Adonis.
marks up. Okay, what would you do if you had like carte blanche to do whatever you needed to do?
First, I asked the patient the question: what bothers you about your body?
What
you're in good
bothers you
shape.
about
You're
your
in
body?
bad shape.
I mean, everything. I'm flabby. I don't know. I would like to get a little bit over in the mid area, my belly, my sides.
Okay.
You know?
Don't forget your wiener, T.
With the wiener, we're not doing wieners.
Oh, and the yeah. That,
Okay, here we go.
Make your pec hard, like harden your chest a little bit. Okay, so there's like a little bit of extra fat here.
Okay.
that we
Around
can
the
put there.
nipple.
Right, yeah, right
Right.
around there.
right nipple.
Okay,
Okay.
both sides. Okay, cool.
Okay.
There's a little bit.
I'm
like-
sucking it in a little
Yeah,
bit.
relax. Just let it hang out. There we go. There's the weird.
Okay, he drew a line from his breast down to his belly button
Yeah,
and
so
under
like-
the breast.
Yeah,
What does
so-
that mean?
I'm just marking some landmarks here. So. Yeah, so a little lipo. I think a little lipo just to like give a little more. He's got a six-pack in there, but a little more definition.
But you
Take
can't
out a
see
little-
it. You can't see it.
You can't see it because
Right.
there's some fat over it. you
So
know?
don't we all have six packs if you think about it, right? Just some are more defined than others.
Some are more defined than others.
What about his love handles, Dr. Miami?
They're not bad. He's not in bad shape.
Look at that,
A
Gregory.
little bit on the side. There.
I'm not in bad shape. How about that?
He's not in bad shape.
No, what about his round
yeah,
head?
bring your-
Is there
bring your-
something
bring
you can
your
do about
chin
his...
down.
Aw.
Okay, we're looking at the chin.
Actually, this would make the biggest difference. I think actually is
On the
is
chin.
Yeah, turn to
Oh,
the side.
really, T?
Yeah, and a chin implant would.
No, don't you draw my face?
Yeah.
Oh no!
Sorry, bro.
Well, we got to get ready for the procedure.
He does have a good butt. Look how cute his butt
butt's
is.
very tight.
His butt
It's a
is very
soccer
tight.
butt.
Yeah, soccer butt.
All right.
Put your lips together. Yeah, I think actually the chin implant and the neck would make the biggest difference for him because his body's not bad. He's got a little bit of fat here and there, but he's muscular.
Not bad.
He's in good shape.
Look at that, Greg T.
And the butt?
The butt is spectacular.
You got a fine
Don't
fanny.
ever touch the butt.
All right.
All right.
All right.
And we're good.
Thank you.
That's it. So,
it, man.
thank you, Greg T. Let's take pictures and make sure we get that up so the world can...
How do I look? How do I look?
I'll see you in Miami.
All
This
right.
is our before picture.
Nice to meet you,
Nice
sir.
to meet you, too.
You always are welcome to visit Dr. Miami on Snapchat, of course. It's the real Dr. Miami, correct?
Correct. The real doctor. On all social media, the real Dr. Miami.
The real Dr. Miami. And what do you have coming up? I mean, other than the busiest days ever. I mean, do you have room for anything else?
It's just butt lifts as far as the eyes can see.
Dr. Miami, it's a pleasure meeting you. Congratulations on everything.